hygiene, it may affect the person's appetite, it may affect the way the person takes care of himself or herself generally. So that's the first part of functioning. Then the second part is academic or occupational functioning. It may affect the fact that the person may not go to class, may not be able to read appropriately, may not be able to attend classes, may not be able to pass exams because it's not reading or assimilating appropriately. So the grades may go down and all of that. At work, it may affect the person's work. The person is not meeting targets, is not meeting deadline, is not as productive as he or she was or is expected to be, is not having good relationship with colleagues at work and all of this. And then for family functioning, persons having problems keeping relationship or good relationship or cordial relationship with spouse, children, siblings, parents. Relationships are strained because of the depression. And then generally the person is not just able to function appropriately in the society. And this is when we can now say someone has depression. However, it still has some other features that we are still going to talk about. So one of the major differences is that sadness is temporary and is usually linked to a particular event or circumstance. But depression is more complex. It's more complex, is persistent, is impairing, and affects how the person perceives life or enjoys life. So that's one of the major differences between sadness and depression. Now, looking at the depression by the numbers, it has been said that almost 5% of the world population has depression. Recent figures from the WHO have shown that over or close to 300 million people worldwide live with depression. And then in Nigeria, about 3 to 7% of the Nigerian population have depression. And depression has been shown to be commoner in women than in men. And some factors have been highlighted for this: hormonal, social roles, and all of those things. And then it is a major contributor to global disability. And it is the second leading cause of years lived with disability. And suicide, which is a major consequence or a major feature of untreated depression, remains a leading cause of death among the young people. And that is why, looking at these numbers that are staggering, that is why it's actually very important to discuss depression, to understand it, and to know how and when to seek for help. So now, to the main crux of the discussion now, what are the symptoms of depression? What do we see in a person or in ourselves before we can start thinking that this may be depression, and when we would now need to seek help? There are some major features of depression. Usually, according to diagnostic manuals, there are usually 3 things that we should look out for first. First is that the person will feeling sad, dejected, empty, weepy, irritable, and this happened for most time of the day, every day, for at least 2 weeks. And it could be more. It could be for months, sometimes it could be for years, depending on the severity of the depression. And then there is lots of interest in activities that are usually enjoyed or previously enjoyed. So we have people that would usually love watching football, love watching movies, love reading books, but they just notice that they stop enjoying these things, or they don't have the zeal or the interest in doing some of these activities. This is a major feature of depression that people tend to overlook. And then they feel very tired or low in energy most of the time. So I'm going to give some examples here. So I was seeing someone very recently on a, what's it called now? On a virtual consultation. And the only complaints, in fact, the complaints that the person had that made him wanted to see a psychiatrist was the fact that he was just getting tired easily with or without activity or with very little activity. And he went on to do all of the cardiac workup, ECG, echo, fasting lipid profile, and all of that. And they were all normal. They all came out normal. So it was one of the cardiologists that just told him that, why don't you see a psychiatrist? That sometimes some of these things are psychological. And when I interacted with him at the interview for almost an hour, we discovered that there are actually symptoms of depression. And what he noticed for himself was just that he was getting tired. But there were a lot of other symptoms that he had, which he was not paying attention to. So sometimes it's just those things that we do not really count as psychological, because some of the time psychological conditions can manifest as things that look physical. So for this person, he also had crawling sensation and peppery sensation and all of that. I'm still going to make a lot of examples from this person, especially as we go on. But the point here is that just feeling tired and low in energy is a major symptom of depression that people may not focus on. And then others will include sleep problems. So this person, for example, too, for him, he didn't even see it as a problem. But almost every day, he would not be able to initiate sleep until about 3 a.m. And then he would sleep for another 3-4 hours and then wake up 7 a.m. or 8 a.m. and then that's all. And then it doesn't sleep during the day again, and then the cycle continues. And then it now makes it easy because he feels he's working up until 3 a.m. That will not be the convenient excuse. I also saw someone some 4 or 5 weeks ago, high functioning individual who also came into the hospital for a physical complaint. And then while the doctor was saying they were suspecting that there could be a psychiatric comorbidity. So when we interacted with this person, also a lady, we also discovered that she wasn't sleeping well. However, for her, it's just what she's used to. That is how her sleep pattern has always been. That was what she thinks it is. But for most people, sleep is usually the first sign that they will see. But people do not pay particular attention to this. And for many, it's either they're having problems initiating sleep. That means they're sleeping very late. They will be on the bed. They will not be able to sleep. And then they have to stand up and then do other things and then hope that the sleep will come and all of that. For some, they're able to sleep, but they wake up intermittently at night, very frequently. And then for some, which is almost very classical of depression, is that they sleep, but they wake up earlier than their normal time. So for people that would usually wake up maybe around 5, 6, after they've slept from like maybe 9 or 10 or thereabouts, and then they find themselves waking up 2 a.m., 3 a.m., and then they're not able to go back to sleep. For some, it may even seem like, yes, maybe they are sleeping, but they wake up very unrefreshed. They wake up very unrefreshed and they do not really feel like they've had a proper sleep. So sleep is actually a major concern that people do not pay attention to. And as we usually commonly say, sleep is like the fever of psychiatric conditions or psychological conditions. You know, when we have fever, it could be that you have just malaria, an infection. It could even be something more serious and all of that. But for sleep usually shows that there is something going on with the mind and with the brain, and people do not pay so much attention to it. And then for some, even in depression, for some, it could be that the sleep problem will be that they are now oversleeping. So some people, for their own manifestation of depression, could be that they now oversleep. They sleep longer than what they used to, how they used to sleep. They sleep during the day, and all of that. And then there could also be changes in appetite, which could either be reduced appetite or increased appetite. And then there's poor concentration and easy forgetfulness. So for the person I said I saw recently, one of the features he had was that. So for this person, he did not have all the classical features that you'd expect. Maybe he's sad, he's down, he's not able to do anything, he's losing interest in activities. I will come back to that loss of interest. But he had all of these minor symptoms here and there, and it seems like he was just masking the major ones and all. So for this person, he's doing very well, he's an entrepreneur and all that, but he noticed that he's been forgetting things recently, he's not able to pay attention and concentrate on things for so long and all of that. So, and then some have low self-esteem, feeling of worthlessness. Some have very excessive guilt and regret over past events and actions. In fact, some have so much excessive guilt that they even that it gets to the level of delusion at times, delusion of guilt. What that means is that they even start to blame themselves for some actions that they did not actually do. But that's usually in the extreme. But this happens, and then there's this feeling of hopelessness and helplessness So the future seems bleak. They feel like they cannot help themselves. Everything just looks like it's better it ends. And then that is what now lead to suicidal thoughts. And then some eventually attempt suicide and some complete suicide and all of that. So that is why it's important to know all of these things, because there is a way the symptoms link to one another until it gets to that point of suicide, which we always want to avoid. And then for some, they could be irritable. For children and adolescents, we see decline in school performance, we see school refusal, there's reduced interest in spending time with others and all of that. So now what the causes of depression? So now there's no one cause of depression. There's nothing like this is the cause of your depression. It doesn't work that way. So depression and even most psychological conditions usually come about as a complex interplay of different factors. So we usually say nature and nurture. So it's usually an interplay of biological factors, psychological factors, and social and environmental factors, such that it's now a case of resilience and vulnerability. So the more of these factors that one person has, the more vulnerable the person is to coming down with depression. So for example, under the biological factors, you have things like genetics, maybe the individual has a family relative, maybe close or distant, that has had depression. So there is already that genetic makeup in that person that predisposing him or her to also have depression. And there are things that could have happened while the person was young, in utero. That's when during pregnancy, at the early phase of childhood, during birth and all of that, that illnesses that could have happened to the person that could predispose the person to future psychological condition. And then there are conditions the person may have, chronic illnesses, cancer, other form of chronic conditions that could also predispose to having depression. And then psychological factors, maybe adverse childhood experiences. And this is an area that we need to pay a lot of attention to. And in fact, in recent times, one of the things that has been highlighted is that most psychological conditions and most behavioral conditions have been linked to adverse childhood experiences. So what are adverse childhood experiences? Adverse childhood experiences are basically any form of traumatic events that happened when someone is a child that's less than 18. And so there are different forms of events. It could be abuse, it could be neglect, it could be any form of violence and all that. So abuse could be physical, emotional, sexual. There could be household violence, maybe a child witnessing the parents fighting physically, or it could be sexual abuse if this person was abused as a child and all of that. If the person witnessed community violence or collective violence within the society. So these are adverse childhood experiences that are psychological factors that could bring up depression later in life, especially when there are now other social factors that are now coming into play. So social factors will include unemployment, marital discourse or poor family functioning, a loss, negative life events, maybe loss of a spouse, loss of a loved one, and then even sometimes even the general social environment. So for example, the inflation rate and the economic situation in the country. I remember then when there was this cash crunch, a lot of people came down with what's it called now? Depression and other forms of psychological condition, especially people that were already vulnerable, people that already had biological and psychological factors that could have led to depression. So all those social factors also coming in when there was COVID-19, there was lockdown. This brought out a lot of relapse of depression or even new cases of depression, anxiety, and other conditions. So this is how it works. So it's usually a complex interplay of all of these factors, leading to the breakdown of the resilience these individuals have, and then leading to more vulnerability to having this. And then one other very important factor is the use of substance. So one of the the use of substances of that's alcohol and other drugs have been on the increase exponentially recently in Nigeria and other parts of the world, but especially in Nigeria, because we need to know that the prevalence of substance use in Nigeria is 3 times that of the global prevalence. So it's a major cause of concern in Nigeria, and it is increasing the prevalence of depression, anxiety, and other psychological conditions also, because substance use and substance use disorder is a major factor that leads to substance use, and then we'll talk more about that later. So these are the factors, and it's important for us to understand this, because when we understand this, it makes us understand that, one, there is no one that has immunity from having depression. No one. Not a doctor, not a psychiatrist, not a professor, not a professional, not a CEO. Anyone can have depression. So far you have a brain, so far you have a mind. You are disposed to any of these factors. We are all open to any of these factors, and it's always about how well we're able to cope with the stresses of life, which we are also still going to talk about later on. So these are the factors. I'm sure during the discussion session we would expatiate more on all of this. Now, for the treatment options, one is that there are different. Now, we need to understand that when we are making a diagnosis of depression, we would usually rate the severity. And depression can be mild, can be moderate, can be severe, which will entirely depend on the type of symptoms the person is presenting with and the number of symptoms this person has. And that's why there's usually need that when you think you have any sign of depression, or when you think someone around you has a sign of depression, yes, the first thing is to provide support, to provide a listening ear. We will still talk about all of those things. However, it is also very important that the person must seek professional help. And professional help here is the help of a psychiatrist, because a diagnosis has to be made. And it is a psychiatrist that has the skill set to make that diagnosis, to be able to rate the diagnosis, and then to be able to chart a treatment plan for that particular individual. And there are no two treatment plans that work for, there's no one treatment plan that work for 2 individuals, because these plans are usually individualized based on the symptoms, based on the severity of the symptoms, based on a lot of other factors, the social factors. What are the factors that have even led to the depression? What is the context in which this person is having depression? These are some of the things that determines the treatment plan. So it's not enough just to say you are talking to a friend, you are talking to a family, or you are talking to a therapist, as people say now. You understand? People just throw around this word, therapist, life coach, and all of that. Yes, it's good. People, they are doing their work and they're doing well. However, it is important that someone must first make that diagnosis and then have a treatment plan. Then all the other members of the team can now contribute to their quota, be it a psychologist, psychotherapist, social worker, and all of that. So now, where I went from that is that there are some forms of depression that would do well with just psychotherapy. So when this person is assessed and other form of assessments are done, the person may just need psychotherapy, lifestyle modification, and psychosocial support. But there are levels of depression where there will be need to place the individual on medication, usually antidepressants. However, there could also be some other forms of medications that may be needed depending on other symptomatology. So, for example, we have been talking about depression. However, we need to understand that depression can actually occur in 2 major forms or within 2 major contexts. It could be unipolar depression. What this person has is just a depressive disorder. And we need to understand that depression is a chronic recurrent illness, relapsing illness, rather chronic relapsing illness. What it means is that there is always a chance that there may be a relapse. There may be another episode, you understand? And that is why it's important to have a professional managing it so that we can plan the treatment to prevent, because one of the major goals of treatment will not just be to treat that episode, it's also to prevent another episode or to prevent further episodes from happening. So now there could just be unipolar depression where this person just has depression. However, there could be what we call bipolar depression, when the depression is occurring in the context of a bipolar affective disorder. And bipolar affective disorder, from the name, simply means that is an affective disorder, means mood disorder, a disorder that affects the mood. And mood could be that you are either excessively happy, excessively angry, or excessively depressed. So there is the high and there is the low. The high side is either you're excessively happy or excessively irritable, and that's where mania and hypomania fall. And then the other end of the pole is depression. So for example, someone that is having depression in the context of a bipolar depression may need additional medication other than just what's it called now? Antidepressants. May need mood stabilizers, may need antipsychotics, and then even in unipolar depression, there are sometimes that there are also psychotic symptoms. So the person may have delusion, may have hallucination, and all of that, even in the context of the depression. And I gave an example earlier on when some people could have delusion of guilt. So sometimes they could also require antipsychotics. And then lifestyle modification or lifestyle intervention is usually very important, extremely important in the management of depression. And I will wait till we'll come back to the later part of the discussion where I've highlighted some things that may need to be done in that regard. And then psychosocial support. This is where the family, friends come in to provide support for the individuals. Because usually, most of the time, when there is depression, there are usually social factors. There are usually social factors in the context of that depression. So there must be a resolution of those social factors. There must be adequate support from the family, friends, in terms of financial, emotional support, being there for that person, and all of that. So, and this is actually extremely important in the management of depression. Now, to the next slide, which is self-care strategy. So now, I'm going to say this. I think Dr. Ogunjobi is still online, right? So one of the things I actually learned from Dr. Ogunjobi, who is one of the co-founders of Mind and Beyond, is that I watched her when we were together here in Neuropsychiatric Hospital Arum. I've noticed that she's intentional about enjoying everything she does. And I've not even had this discussion with her before, but while I was preparing for this discussion, I made up my mind I was going to mention it. She is very intentional about enjoying everything she does, whether it's work or whatever it is. She's intentional about enjoying it. And I now discovered that even for so many of us that are psychiatrists, we are not even very intentional about these things. And it is actually extremely important for us to enjoy life, enjoy your work, enjoy your rest, enjoy being with your family, enjoy everything that you are doing. So for example, I said I was seeing someone very recently, and this guy is very, very successful guy and an entrepreneur, CEO, and all of that. And I asked him, what do you enjoy about life? And it took him time to answer. I could not even answer. Because everything he does is about work, work, work. People don't have a proper work-life balance. And one of the things and these are things that put a lot of stress on our mind and eventually lead to psychological conditions like depression. So we need to be intentional about enjoying ourselves. Whatever work we are doing, whatever means of livelihood we have, at the end of the day, the aim is for us to enjoy life. So why are we not intentional about enjoying life? Why are we not intentional about taking break? Why are we not intentional about going for a vacation? Why are we not intentional about even enjoying that work that we do? What are the factors that is not making us enjoy the work we do? What can we do about it so that we enjoy it? Then another thing is self-awareness. We need to be self-aware of what makes us stretched. We need to be self-aware of how our emotions are. We need to know when our emotions are going down. We need to know what is making our emotions the way they are. We need to be conscious and be intentional about our emotions. We need to be aware of what is going on around us and how it affects our emotions and our mood. And the other things that we need to exercise regularly. Exercise cannot be overemphasized. It helps our physical health and it also helps our mental health, because you cannot separate your physical health from your mental health. And as I mentioned earlier, one of the biological factors is that when there is a chronic medical condition, it also predisposes to depression. And then it has also been said by studies that there are hormones and chemicals and substances released in the body when we exercise regularly. And these endorphins have been shown to boost our mood, to help us feel better and all of that. So it's important to sleep regularly. Now, sleeping adequately, and I think I've emphasized that during when I was talking about the symptoms, that one of the major problems that people come down with is sleep problem. And it's because in the first place, people don't even pay attention to their sleep hygiene. People don't even pay attention to how well they sleep. And sleep, I've mentioned it earlier while I was talking about the symptoms, that sleep is the what's it called now? It's like the fever of psychiatry. And also sleep is the food of the brain. If you deprive your brain of sleep, that means you're starving your brain, and then the brain and the mind will definitely come down with a morbidity. So we need to sleep well, we need to be intentional about it. And when we notice that that our sleep pattern is becoming irregular, whether it's getting too much or it's getting too little, we need to seek for help immediately. We need to stay connected with friends, family, and colleagues. One of the things that we have in this generation, especially now, and with the level of social media and all of that, is that there is a lot of disconnection from family and friends. We stay too glued to, what's it called now, to social media. We are building relationship with people that do not necessarily exist. So there's so much fake life, quote and unquote, and we are not building real relationship, because this social connection that we have with real people helps our mood, helps us to stay connected with people that really matter. So we need to do that, because at the end of the day, these are people that will really matter. These are people that will really be there for us when we need support. And then we are not comparing ourselves with people that are also fake, and then we are forming fake life and all of this. What this does is that it just continues to increase the level of anxiety and the stress that we put on ourselves, because we want to achieve this, because we want to respond to this person, you want to feel like you know how to counsel people the way they're counseling people, and all of these things that come with social media use. So we need to stay connected with friends and family and reduce our social media use. We need to limit the use of social media. Yes, it's good, of course. It's social media we have used to even communicate this program and all of that. So there are a lot of things we can also do on social media, mental health advocacy. Some people, their work is even built around social media. Their livelihood is built around social media. But however, we need to limit the harmful use. We need to, and that's where self-awareness comes. We need to know when this is beginning to affect. And I'm going to use a particular example. So there's this, I don't know if some of us are familiar with Fantasy Premier League. So there were times that I used to play Fantasy Premier League, and they would usually check Twitter to see what is happening. And then I noticed that every weekend, my mood was always getting really bad with this. So when my players are not scoring, and the thing is, there's no money involved, there's no gambling, there's nothing. It's just bragging rights with your friends that you are in the same league and all of that. And then I noticed that every weekend when there's Premier League and I have to check my Fantasy Premier League team is not doing well, my mood will be poor for that week. And it affects a lot of things around me. But when my team does well, I'm happy and all. So I knew that, no, there's problem. So about 2 years ago, I completely stopped it. And I was very intentional about stopping it. In fact, I discussed it to some of my friends that, guys, I think I can't continue this thing. It's really messing up with my emotions. And I can tell you that even some of them, when I voiced it out, some of them also now realize that it seems I feel the same way. And in fact, I can tell you that for most of us, we don't even play it anymore. So we have to be conscious about some of these things. We are not really conscious about it, but it has a way of affecting our mood and our emotion. And then I have also mentioned this, that alcohol and drug use, very prevalent now. A large number of patients that we even see in our hospitals are substance use patients coming down with comorbid psychiatric conditions, including depression. Now, for most people, or for some people, their use of substances in the first place was even based on the fact that they needed to medicate their poor emotional state. So some of them had depression, some of them had low self-esteem, low self-worth, anxiety, and the way they thought they could cope with it was by using substances. However, what this does is that the substance would even now make it worse. Even though the initial phase, they get some eyes and they think it's masking that depression and low self-esteem, but it gets worse over time. And so for people that use alcohol and other drugs, the best bet is for them to completely stop it or seek help to see how they can stop it gradually until they're able to abstain completely. And there is help for this also. And then most importantly, it's always good to seek professional help. As I was saying, the person I was seeing very recently, he was very intentional about seeking professional, even though he doesn't seem to have a full-blown depression and all, he's still able to go about his work and all of that. And I know this is something that we have also discussed in this forum, that's a functional depression at some point, that it doesn't mean that an individual who is doing well at work, is a CEO, is a consultant and all of that, what we are all seeing is that that person is doing well. But then there is depression going on and it's affecting some areas of his life that is not so apparent to any of us. So we should not wait until when it now becomes very clear and apparent before we seek help for ourselves or for those around us. So let's talk about some myths around depression. So one of the myths is that depression is just sadness. Are we together with the slides?
We are together.
Okay, so one of the things is that depression is just sadness. Depression is not just sadness, and we have explained this extensively from the beginning of the conversation. Sadness is a normal reaction to circumstances, but depression is a clinical condition that has features. It lasts longer, it is more intense, it affects functioning, and it has some other features that characterize it. Now, depression is a sign, and so another myth is that depression is a sign of weakness. And this is one area, especially in this part of the world, it's a major concern, though it's getting different now. In fact, I think we are getting the opposite of that now, where sometimes people even fancify depression and say, I'm depressed, my mental health is affected, and all of that. We get with the Gen Z and all that. However, it's a large part of the population, maybe some of the young population, the middle-aged and the elderly. Culturally, we still see depression as a sign of weakness. And that is why in this part of the world, you will see that some of the presentation of depression may not be the psychological symptoms. It may be the physical symptoms. In fact, I remember sometime last year, I met someone, a high-ranking government official in Abuja, and the complaint was just that I'm having this headache, this crawling sensation and peppery sensation. I'm like, classical, you understand? But when you start to ask questions, when you start to probe, you see that there is something really going on beyond what the person is talking about. And then another thing is that, so it's because of the feeling that it is a weakness. So people mask the real signs that they are feeling, but it's nature. The nature will always show the signs. So it now comes out as physical symptoms rather than psychological symptoms. But when we prove, and some of these people, they go to general hospitals, they go to OPDs, private hospitals, they go around, they do all sorts of tests before they eventually now come to see a psychiatrist. So because people think there is a weakness and they are not able to manifest the symptoms, so they come down with physical symptoms. Some do not even present at all, especially among men. I think this month is the month for men's mental health. And one of the conversations that has been going on is how men should talk out more about their feelings and emotions. Because what we believe classically in an African setting is that men are strong, men cannot have depression, men cannot be weak. However, in fact, what statistics have shown, what even data from WHO has shown, is that men commit suicide more than women. Even though women may attempt it more, but men, and we know that more than 90% of suicide happen as a result of psychological conditions like depression. So it is not a sign of weakness. Anyone can have depression, regardless of the status, regardless of the race, gender, socioeconomic status, and all of that. The most important thing is to get the help that is needed and required. Another myth is that you can snap out of depression. Depression is not sadness that you can snap out of. Depression always requires intervention. Sometimes Some may have clinical depression for months, and then it will go it will wane with time. However, there is a very high chance that there will be a recurrence of episode, and that is why it's always very important to treat depression. And it's untreated depression that will become severe enough to start having suicidal thoughts and suicide attempts. And that means that it's only adults that can get depressed. All age group can get, children, adolescents, adults, elderly, anyone and everyone can get depressed, even though the signs and the symptoms may differ according to the age and demographic. Antidepressants change your personality. So let me take this and the last one together. That antidepressants can change your personality, and that medication is the only treatment for depression, and medications are addictive. And we get this a lot. In fact, I saw a patient some 4 or 5 weeks ago, as I mentioned earlier, and her fear, she was open to, she accepted the diagnosis of depression because I explained the symptoms to her and everything. But her fear was, and she needed, because she had about like moderate to severe depression, and she needed to be on medication. But her fear was, I heard that medications are addictive, that once I start, I cannot stop. So these are just myths. Antidepressants, which are the major forms of medication used for depression, are not addictive. You understand? And medication is not the only treatment. There are some form of depression that will do well with just psychotherapy, and there are some that will need a combination of psychotherapy and medication. And antidepressants do not change people's personality. And talking about depression or suicide does not make it worse. We need to talk about it. If you feel any way, you need to talk about it with your close ones. You need to seek professional help. Talking about it is not going to make it worse. In fact, talking about it will make it feel better. I remember I was having a session with someone earlier today, and after we had spoken for like about 45 minutes, and I asked him, how do you feel? He said, I feel so much better just after talking. So, and this is the classical thing that we get. So talking about depression is not a problem. And then if someone is high functioning, they can't be depressed. That's another myth. And we have also mentioned that briefly. There is something we call functional depression. People can actually be high functioning, but they can actually still be depressed. So now, how to help someone? If you are around someone and you feel that this person may be going through depression, what's your role? Even not being a health worker, even if you're a health worker, you're not a psychiatrist, you have to acknowledge, listen to that person. You have to acknowledge the emotional pain, the sadness, the feeling, or whatever the person is going through. You listen to the person, you provide support, you say soothing words, you talk to the person in a way that you understand that he is loved, or he or she is loved and is being listened to. You encourage the person to get professional help. And I want to emphasize this over and over again, because there seems to be a lot of misinformation. Though we need to acknowledge the fact that mental health advocacy is getting so much better now. However, there are a lot of people that call themselves mental health professional, life coach, therapist, all sorts of names, people without any form of proper training on Twitter, Instagram, everywhere. We need, as mental health professionals, we need to talk more about this, because some of these people may also be causing more harm than good. People need to seek proper professional help. And then we need to encourage self-care. And we have talked about some of those self-care strategies earlier. People with depression can recover. We have seen people, we have managed people with depression. They've done well, they've recovered. People have gone back to school, graduated with good grades. People have gone back to work, and they are doing very well. They can succeed. They can build their careers all over again. People can live meaningful lives, because at the end of the day, the aim of treatment is for people to become more functional and to be able to live a more meaningful life. So take home message: depression is not just sadness, it is treatable. Help is available and recovery is possible. So you do not have to struggle alone. Help is available, healing is possible. And I want to appreciate Mind and Beyond for this opportunity. And I want to believe that we have gotten some things from this conversation, and I will be open to further comments, discussion, and maybe a few questions. Thank you very much.
Amazing. Thank you so much, Dr. Odumbaku. That That felt therapeutic in itself. Thank you so much. So many take-home points. I wish you were here. My jotter is almost full. I think you need to give me some money to buy another one, because what was that level of stuff? And the fact that you were able to focus on the whole audience, not just the medical professionals that are present, but even the other people. And I can see even from the engagement that people were following. And of course, we have people who have stayed till the end because you brought value and you brought your whole heart to this. I heard you the other time. I think my speaker was playing up. Thank you. You left me blushing there. Does anyone have? Okay, so we've got a question in the chat box, and I'm very aware of our time. If we could just have a few minutes more, just so that we can totally tackle this. The first question, Dr. Dumbaku, is, can the symptoms of depression be someone getting lean without any cause? That's someone losing weight or unexpected weight loss without any cause? Dr. Dumbaku, are you able to help us tackle that question?
Okay, thank you very much. Yes, weight loss is actually one of the symptoms, one of the minor symptoms of depression. And sometimes it comes with the loss of appetite or reduction in appetite. However, we also need to be cautious a bit here. Just like the example I gave where I said the individual just came with the complaint of what's it called now? Easy fatigability and getting tired easily. We also have to rule out possible physical causes of such things. You understand? So even when we are seeing weight loss and we are not seeing classical signs of depression, we would always try to rule out possible physical causes, ask some questions, do some investigations and all that. However, it is not impossible that weight loss, unexplained weight loss, may also be from depression, especially when we now ask questions and then we are able to pick a good number of signs of depression in that person, enough to make a clinical diagnosis of depression.
Yes. Yeah. Thank you. Very well tackled. So yes, it could be, but normally it's not the single symptom that would culminate into the clinical diagnosis of depression. There has to be other things, just like you said. So Bloom is asking, thank you so much for the value loaded delivery. I agree with that. Can you please expatiate more on functional depression? Maybe just a summary.
Well, I know we've taken that in this this thing, and one of those lectures that I enjoyed the most. So it's a discussion on its own. So I'm not sure we'll be able, but in some way, and I think I've mentioned it in some way, functional depression just means that there is depression. However, what we would classically see that comes with depression, which is the loss of functioning or reduction in functioning, where it's obvious that this person's functioning is being affected. It's not seen in functional depression, and it's usually seen in professionals. How will I put it now? The CEOs, yes, and all of those people. So they are doing well. You are seeing them doing conferences on TV. What everybody is seeing is someone that is doing well. Celebrities. In fact, I remember them. Dr. Gunede was one that took the lecture. She gave so many examples of celebrities who, what people just heard was that they've committed suicide. So it's now psychological autopsy and looking back that would not say, okay, yeah, there were actually signs of depression, but you would not see it because they were functional. It was always in a concert. It was always collecting Grammys. It was always doing this. So it's not, those classical signs of dysfunction will not be seen, but there are signs of depression.
Thank you. We have some videos on Mind and Beyond on YouTube. If you really want to delve deeper into functional depression, you could find something there. We have one last question that we'll be taking today. If there are any other questions, you could email us. I would drop the email link in the chat box. Dr. Dumbaku, are we still okay to speak one more question?
Yeah, the Osman.
Okay. Dr. Yasir Karim, our boss, is asking, thank you, Mr. Speaker, sir. How do we build resilience in this challenging, sad moment as Nigerians? How do we build resilience?
Well, this one that my teacher is asking me a question. So I think we are in exam mode. Okay, so anyway, I think some of the self-care strategies that we talked about are very good strategies to build resilience. However, in the context of Nigeria, and especially looking at the economic situation and all of that, we need to have some deeper conversations about living within one's means, being realistic with spendings. Some of these things sound like, what is a psychiatrist's business with all of these things? But they are extremely important. They are extremely important because these are things that affect our day-to-day activities. And as trivial as they may seem, they have significant impact on our emotions. Significant impact on our emotions. Just living within your means, this is the salary you're collecting, you are not living above that, you are contented with what you have, you are trying to build yourself, you are trying to develop yourself for more opportunities and all of that. Then even the issue of bad news, kidnapping, banditry, that is where self-awareness comes. If you have observed, and we have seen classical cases of this, in fact, I've had patients with this, bad news on TV as a way of dampening their mood significantly. So what they do, or what you should do in that case, avoid listening to some of those news, avoid listening to some of those things. Enjoy other things, concentrate and focus more on other things, you understand? And then also, let's just take care of all of these self-care strategies that we have listed earlier. Just focus more on making yourself better. Be like Dr. Ogunjobi that loves to enjoy life. Enjoy every part of your life. So, but I'm sure it's a whole lot of other lecture about resilience, because when we talk about resilience, it's something that we should even start teaching from childhood. You understand? And that's why some of us are advocating for mental health education to even be part of the curriculum from as little as primary school. There are some resilience skills that we teach children and especially adolescents. You understand? So these are things that we would have to build over time. Resilience is not something that you just pick up like that. You have to build it over time and then you get better at it. Thank you.
Thank you. Honestly, what just came to mind is that we could actually stay here all night and we'll just be enjoying ourselves and just getting strategies. This was such a wholesome conversation, honestly, and I'm not even trying to hype or anything. If you agree with me, can I see thumbs up? I mean, that's the only reason why everyone has stayed on a Thursday night up to this time. This has been a wholesome conversation. It's been so full of energy, important facts. I love how you were dishing out the facts systematically, and it was just sinking in. Thank you so much, Dr. Dumbaku. This was totally worth the time, the effort, and your presentation was simply amazing. Thank you so much. So over to you to just wrap up.
Thank you very much. I mean, he had not finished when I said that this was a masterclass, because honestly, he covered almost everything. Even some of my questions that I had, he answered them in the second to the last slide. So thank you very much, Dr. Dumbaku. We really appreciate your time. We appreciate your knowledge and your expertise. Thank you so much for sharing it with us today. One thing that I want us to take away from this time is our African philosophy called Ubuntu. I am because we are. Even if when we look at depression from an evolutionary perspective, one of the things that makes it so easy for a lot of people to recover is because of that social network, that social support, because you cannot afford to remain in that situation for so long, where you just have people around you who can help you move forward with the right support and with the right treatment. So thank you so much, Dr. Dumbaku. You have shared so much with us today. And Dr. Dumbaku is so right. Omotola is a ministry, she's the minister of enjoyment, and she has some availability available. So if you want consultation, if you want practical strategies that you can mold into your own personal life, she has some slot available. I think she can share a link in the chat box for anybody that wants to book an appointment, so that you can think together about how to use some of these strategies that have been shared today. So thank you everybody for joining. Thank you to a lot of our colleagues and teachers who have joined today's appointment. We are today's webinar rather. We are so grateful to have you join us all the time. There's no Minds and Beyond without you all.
Sorry for cutting you. Sorry for cutting you. I think we need to specifically appreciate our teacher. Sorry, our teacher of teachers.
Okay.
I
didn't see him. Thank you so
you
much
so
for
much,
joining,
Dr.
sir.
Kodumi. It's one of our biggest supporters. It shows up
Yes.
for us all the time. Even for me, when I only remember him when I need something, it doesn't say, I know you need something. It shows up. I inconvenience him all the time, and it shows up. Thank you so much. We are really privileged to have your support. Thank you so much for joining, sir.
Thank you.
All right, thank you, everybody.
Thank
Have
you,
a lovely
everyone.
night rest. Get that sleep in. Let's feed
Yes.
that brain with loads of sleep. Wake up with physical activity and exercise, and we'll see you next month.
See you next month, everyone. Thank you for joining. Thank you, Elizabeth. Thank you, Timmy Tokwe. Thank you, Okoyemi. Thank you, Grace. Thank you, Baba Chide, for joining so early. Letondu Baku. Thanks are recurrent. Dr. Kolade, thank you. Dr. Shewini Yola. Shafao, I'm not sure. Then Uweme Dimo, sorry if I didn't pronounce it right, and Ray. Thank you so much, everyone, for joining. Have a blessed evening.